that about 1 in 10 young adult Filipinos experience depressive disorder. What is a depressive disorder? A depressive disorder is an illness that involves the body, mood, and thoughts. It affects the way the person eats and sleeps, the way one feels about oneself, and the way one thinks about things. A depressive disorder is not the same as a passing blue mood. It is not a personal weakness or a condition that can be willed or wished away. People with depressive disorder cannot merely pull themselves together and get better. Without treatment, symptoms can last for weeks, months, or even years. But the good news is, treatments are available, and we can help most people who suffer from depression.
What is anxiety? Occasional anxiety is a normal part of life. Many people worry about things such as health, money, or family problems. But anxiety disorders involve more than temporary worry or fear. For people with anxiety disorder, the anxiety does not go away and can get worse over time. The symptoms can interfere with daily activities such as job performance, schoolwork, and relationships. There are several types of anxiety disorders, including generalized anxiety disorder, panic disorder, social anxiety disorder, and various phobia-related disorders. So what are the signs and symptoms of anxiety? Symptoms of anxiety include feeling restless, wound up, or on edge, being easily fatigued, having difficulty concentrating, being irritable, having headaches, muscle aches, stomach aches, or unexplained pains. There's also difficulty controlling feelings of worry, having sleep problems such as difficulty falling or staying asleep. What are panic attacks? Panic attacks are sudden periods of intense fear, discomfort, or sense of losing control, even when there is no clear danger or trigger. During a panic attack, a person may experience pounding or racing heart, sweating, trembling, or tingling, chest pain, and feelings of impending doom, feelings of being out of control. How is anxiety treated? Anxiety disorders are generally treated with medication, psychotherapy, or both. There are many ways to treat anxiety, and you should work with a mental health care professional such as a psychiatrist and a psychologist to choose the best treatment for you.
Depression is a mental health condition that can cause children and teenagers to feel very sad and hopeless. Kids with depression have trouble enjoying things they used to love. They may also seem listless and easily annoyed. Depression can have a lot of negative effects on a child's life, like missing school and not wanting to be around friends. It's normal for children to feel sad when bad things happen, but a child with depression doesn't feel better if things change. Kids with depression might think about or attempt suicide. There are two kinds of depression that a child can be diagnosed with. Major depressive disorder, which is a severe symptoms that last between 2 weeks and several months. Persistent depressive disorder, also called dysthymia, less severe symptoms that last for a year or more. Depression usually begins during the teenage years, but younger kids can also be diagnosed. Girls are diagnosed twice as often as boys.
As we get older, symptoms of anxiety and depression are commonly encountered. Did you know that up to 1/3 of the elderly population suffer from anxiety and depression? Common causes include health problems such as heart disease, stroke, dementia, Alzheimer's disease, cancer, chronic pain, and even insomnia. If you think that someone you know suffers from anxiety or depression, please go to the Mind Wellness Center of Asian Hospital and let us help you.